If you have lower back pain caused by a severely damaged disc, your healthcare provider may advise you to have a lumbar disc replacement. Your lumbar spine is made up of 5 bones. Each one is called a vertebra. These vertebrae protect your lower spinal cord. Between each vertebra is a soft cushion of tissue called an intervertebral disc. Healthy discs provide enough height between vertebrae to allow your lower back to bend and absorb pressure. As you get older, the discs can dry out, bulge, and become less flexible. A bulging disc can press against your spinal nerves. Pressure on spinal nerves can cause pain in the back and legs. As the disc gets worse, small growths, called bone spurs, may form on the vertebrae above and below it. Bone spurs may also pinch your spinal nerves. This can make your legs feel weak and numb. To start the procedure, an incision will be made in your abdomen. After reaching your lumbar spine, the surgeon will remove the worn-out disc. Next, the surgeon will scrape tissue off the vertebrae above and below to expose the bone.
First, identify and mark midline on the superior and inferior vertebral bodies adjacent to the operative level. Second, create an annulotomy centered on midline, wide enough to accommodate the pro-disc. Perform a thorough discectomy using the bone elevator and standard rongeurs, kerrissons, and curettes, ensuring the posterolateral corners are free of disc material. Then, insert the vertebral body spreaders to the posterior margin of the vertebral bodies to gradually remobilize the motion segment. The posterior longitudinal ligament should be completely exposed and released or resected as required to achieve remobilization. Trial implants are used to determine the appropriate implant footprint, lordotic angle, and disc height.
I've already seen what it can do.
At this point, advance the trial to the posterior margin of the vertebral bodies. Also, the adjustable stop can be backed out to allow the trial to be positioned more posteriorly. Next, advance the chisel into the vertebral bodies until it is fully seated on the trial. The chisel and trial are left in place until the ProDisc L implant is ready for insertion. Now, load the inferior end plate and superior end plate onto the inserter and nest the 2 end plates together. Once complete, remove the chisel and trial. Align the keels of the ProDisc L implant with the chisel cuts and insert the end plates to the posterior margin of the vertebral bodies. Then, load the polyethylene inlay into the grooves in the inferior arms of the inserter. Assemble the distractor to the inserter and use the thumb screw to fully advance the distractor. When that is done, verify that the posterior edges of the end plates have separated from each other. Insert the inlay pusher into the grooves in the inferior arms. Then, manually push and lock the polyethylene inlay into the inferior end plate. Finally, remove the instruments and verify final implant positioning. If performing a 2-level procedure, repeat for the 2nd level.